Hi, this is Dr. Isaac Tawil, Clinical Director at Shining 3D and practicing clinician in New York City. With the Elite Intraoral Photogrammetric system, we've developed the HACS system, High Accuracy Coded Scanbodies, to be used for intraoral photogrammetric implant capture. We've proven already that this is one of the most accurate ways to capture implant positions. Utilizing our horizontal scan bodies that will act as both intraoral scan bodies and photogrammetric solutions, we've taken it a step further. First, we've removed the screw, making it easier for other systems to be able to accommodate to our existing scan bodies. Secondly, we've introduced a revolutionary new technology within our software. Now pairing with the HACS coded scan bodies, we've introduced coded healing caps. Since now we have two options to scan the high accuracy coded scan bodies and then match them to either the surrounding tissue or to the cap scan bodies, we'll take you through a small demonstration of how either of these solutions work. The first step is to set up the case. First, we will sign in to our existing account, and we will start a new order. You'll notice that now there is a new addition to the software. We now have an Intraoral Photogrammetry selective tool. By selecting the tool, we can then, of course, still select which scan body kit that we will be using for that specific scan. And in this case, we'll be scanning 4 implants. So we'll pick 4 implants to choose. The new addition will be found in the upper right corner of the screen. We can now choose whether to use scan matching or the coded scan body matching option. For the first scan, we'll show the traditional matching, which is the tissue matching scan. The software prompts to choose the implant system. Typically, we like to have the aal-on-x option engaged, but since we are going to be utilizing this on a model, we will pick the model scanning mode. The one-touch button within the Aoralscan Elite and Elite Wireless allows for seamless step-by-step movement without having to touch a screen or the keyboard. By pressing once on the Elite, we'll begin to engage into intraoral scanning option. The next step would be to remove the denture and start scanning the tissue at the MUA level. Since there is no opposing dentition on this model, we're going to skip the opposing dentition for this case, as well as the occlusion. The next step would be to scan again in the model scanning mode of the multi-unit abutments. When using intraoral scan matching, it is imperative to capture as much data as possible so we can overlay our initial restoration of scanning or initial teeth that presented in the mouth to the multi-unit tissue scan level to allow for that scan matching to be integrated easily. A heat map has been integrated into our software, showing how much of the accuracy has been captured between our initial scan of either restorations or existing teeth to our tissue scan level of that multi-unit surfaces. Additionally, if for some reason scan matching is not possible within the software by automatic integration, a manual option is available. By providing 3 points of overlapping data, we are able to have the software match this manually. And again, a heat map will show you how much is overlapped with accuracy. So whether manual or automatic, our software now is able to dictate how much of that overlapping is accurate or inaccurate. When installing a Scanbody box, we have the ability to scan the QR code and have the computer recognizing according to the QR code, or installing manually. You'll notice the QR code is at the top left corner of the box, and it is also located underneath the actual high accuracy coded Scanbody flag for your convenience. If multiple boxes are being sterilized, it's important to make sure that the QR codes and the serial numbers match the actual high accuracy coded Scanbody kit. Selecting the right kit is important. We can go towards the download page and have all of the high accuracy coded Scanbodies captured. What you'll notice is that it also shows you the number of uses that each Scanbody was being utilized. This is especially important as over time we can have screw fatigue. We are now able to swap those screws out of the scan flag and install new screws, ensuring that we will not have screw fracture. The next step would be to install the photogrammetric Scanbodies and start our intraoral photogrammetric scanner with either the Elite or the Elite wireless scanners, using the large window intraoral photogrammetric, or otherwise known as IPG scan tips. When installing the intraoral photogrammetric high accuracy coded Scanbody tips, it is important to provide as much overlap between these Scanbody flags as possible, as the further away these distances are, the less accurate the scan will be. So creating an overlapping center should be our goal. In an ideal solution, having an overlap between the high accuracy coded Scanbodies will provide a higher accuracy and a quicker scan capture. Notice how all these Scanbodies are pointed towards the center of the arch. However, if more convenient, the Scanbodies can be pointed in a different direction as long as overlapping between the objects is still an available option. Meaning, if the Scanbodies can meet towards the center pointing towards the facial, this is also acceptable. The key being to have this area surrounding in the center of the scan capture to provide for higher accuracy. Centering over each Scanbody will import the Scanbodies faster and with more accuracy, since the video stream-based photogrammetry works by keeping the data between each Scanbody and then allowing direct capture. It's important to capture a good amount of the Scanbody so that we can ensure accuracy, not leaving too many orange dots and having much more green dots. Now showing high accuracy capture of our scan flags. You'll notice there is a separation, a small separation between each scan body so that we can ensure when installed the scan body is sitting directly on the multi-unit abutment and not being stopped by an adjacent scan body, creating a false sense of security that the scan body is actually screwed down into the multi-unit abutment. But by leaving a space and torquing down the scan body to 15 newtons, roughly a little bit more than hand tightening, we are able to ensure that now the scan body is actually sitting on the multi-unit abutment. The next step with our traditional scans is to match it to the existing soft tissue. By scanning the scan bodies and the tissue, the software will automatically merge the two together. It is suggested to take more than one matching scan to ensure the accuracy of the matching of the soft tissue to the scan bodies. However, if only one is able to be achieved, it is acceptable. But think about this more like a bite registration. When we take a bite registration in the mouth, we like to capture both sides of the arch. The same should be thought as to capturing the scan body flags to the soft tissue to be able to make sure that we have an even matching on both sides. The software then prompts to make sure that you still want to use the same scan bodies for conversion. In this case, the scan bodies were pre-selected. If a different scan body is desired to be converted to, it can be done so now or at a later date on our Shining 3D virtual portal in the cloud. If desired, if let's say more than 4 implants were placed, multiple scan matchings can be accomplished by clicking on the plus sign and adding an additional scan matching scan. Now, as you can notice, 3 scans have been captured. One for the left side, one for the right side, and one for the anterior. This is especially important when taking on multiple implants of 6 or 8 implants in an arch. The implant numbers are also populated within the software, making this for easy importation into third-party software such as Exocad. So when opening, the implant are identified within the order form, and there is no need for the lab technician to create any matching of any sort. The software can then be adjusted towards optimization and be ready for exportation through the Shining portal to the laboratory or for in-office use. Once completed, all the scans will be layered within the software for easy importation into third-party softwares. The pre-op scan, the soft tissue scan, and the photogrammetry converted scan with the scan bodies chosen can all be aligned in one software. The software can then be sent over to the laboratory of choice or for in-office use through our MyCloud software. For the Healing Cap Scanbody scan, a slightly different method is selected. After entering the patient's name, choosing the Intraoral Photogrammetric option on the software, and making sure to select the Cap Scanbody option on the screen. If a temporary restoration is desired, one can be done as well. After selecting, in this case, the 4 implant positions, the temporary denture scan can be captured or existing teeth as well. Choosing an implant system is optional, can be done now or later on throughout the process. One should note it is important to capture not only the existing teeth or denture, but the surrounding tissues for easier matching and later identification for your final or temporary restoration. When scanning intraorally, it is important that the aal-on-x feature is engaged for better scanning in the intraoral scanning environment. However, we are using a model here, so we will pick model scanning or extraoral scanning mode. If desired, a touch-free method for advancing to the next screen can be accomplished by a long press on the scanning button, or if a touch-free desire to examine the actual scan is desired, a double tap of that home button and then a raise of the scan will allow for a touch-free view of all scanned surfaces. Again, a long press will advance towards the next screen. The next step would be to install the Intraoral Photogrammetric HACS high accuracy coded scan flags, trying to center all of the flags towards one location for better accuracy and easier capture of our HACS coded scan body flags. The success and accuracy of the intraoral photogrammetric system relies upon the large window that is captured with the intraoral photogrammetric tip. It is important to have as much of an overlap within that window without the scan bodies touching each other. The purpose of the scan bodies not touching each other is to ensure that the scan body is flush and fully seated on the multi-unit abutment. If a scan body is accidentally touching the adjacent scan body, it is unknown as to whether or not the scan body is sitting down and being locked in by the screw to the multi-unit, or if it is because it is butting up against the adjacent scan body flag, which is causing it to simulate as if the scan body is actually seated. So leaving just a sliver of visual evidence that the scan bodies are not touching each other ensures that the scan body is fully seated, providing the ultimate accuracy for the intraphotogrammetric scan. To ensure that the scan body is fully seated, it is recommended that the scan body be torqued to 15 newtons with the torque wrench. As we center around the scan bodies, it is important to create an overlapping circle to allow for easy importation of the scan body flags. As the data is accumulated between each scan body, the accuracy is improved, removing the orange, which is unknown for accuracy, to turn to green, which means that the scan body is known and accurate. Again, we can visualize how there is no touching between the scan bodies within this capture. And all of the captured dots are on the scan bodies, not floating off the scan body. If a different kit was accidentally used, these scan bodies will not be captured into the software. It is also important to note that the scan body can only be captured once. If, for some situation, the scan body is unable to be captured within the first intraoral photogrammetric scan, a scan body can be removed, replaced with a scan body that has not been scanned yet, inserted, and then scanned within the mouth for an additional scan. So in this case, we have 4 scan bodies. If a 5th scan body was desired for a 5th implant but was unable to be captured in this window, a scan body can be removed, placed on the side, A new scan body that has not yet been scanned should be inserted onto the new multi-unit that has not been scanned, and then we can capture for an additional photogrammetric scan. The photogrammetric scan bodies are then removed and now replaced with our new innovative coded healing caps. The next step is to select the coded healing cap scan option. What you'll notice is that we've now created an innovative healing cap that can be automatically captured, matched to our high accuracy coded scan flags. So using intraoral scanning technology and scan matching technology, we are able to match these healing cap scan bodies to our photogrammetric scan bodies. They can be attached with the screwdriver included in our kit, or they can simply be picked up by hand and screwed in by finger. It is important to capture several sides of the healing cap to allow for matching. Starting by scanning the healing caps and the adjacent tissue, and then picking up all sides of that cap scan will import that healing cap scan body. You'll notice all 4 healing caps have been captured. It is unnecessary to capture more than 4. 3 can be enough as well. More the better. However, once 4 is captured, the scan should align quite easily to the initial scan which we had captured prior towards scanning photogrammetric. What you'll notice now is that the 2 scans have been merged. The healing cap scan with the photogrammetry scan in the middle button here. If desired, this can be done manually as well, aligning the healing cap scans by using point matching. Three points of matching is all that would be required to be accomplished for triangulation. The next step would be to align the healing cap scan with our initial temporary denture scan. This can also be done by automatic merging or by manual manipulation. Again, the software will prompt to choose the correct scan body. If a change is desired, it can be done so at this point. Tooth identification as well can be corrected at this point. These final scans can then be optimized and sent over to our laboratory or within the office using our MyCloud feature. Laboratory technicians can now have a seamless integration within the same third-party softwares without having to do scan matching, to allow for a quicker solution for a doctor to be able to print with in-house same-day printing. Combining all this data with the MediSmile, with the intraoral scan, with desktop scanning, along with CBCT integration, being able to provide same-day solutions with proper midlines, correct occlusion, alleviating any canting or miscorrections, and providing ultimate fit for our provisional and final restorations is now not only achievable, but it is expected. and predictable outcomes. So I invite you to join the world of Shining 3D, and now with the new Aoralscan Elite Wireless, to be able to begin your journey, whether it's for intraoral scanning, orthodontics, or aal-on-x solutions. Keep shining with Shining 3D.